This video continues Chapter 16 of OEC 6, looking at GI, GU, and reproductive system emergencies. And in this video, we're going to focus on the anatomy and physiology, because understanding anatomy and physiology of these systems will help us determine what possible causes of the emergencies could be. So we'll see a couple of key terms here. One in particular that will stand out is referred pain. Let's begin. So in assessing the abdomen, we can divide it conveniently into four quadrants, just centered on the umbilicus or the belly button. And so knowing what organs are in each quadrant, such as the location of the spleen in the left upper quadrant or the liver in the right upper quadrant, will help us make a proper assessment. Review Chapter 6 on anatomy for those organs that are part of the GI system and also the GU and reproductive systems. Now, in determining what some of these possible injuries or emergencies could be, a useful classification is to divide organs into solid or hollow. Hollow organs include lots of our digestive organs, such as the stomach and both small and large intestines. They're going to be dominated by these digestive organs because their purpose as hollow organs is to move food and feces and urine all the way through before being eliminated at the end of the system. Hollow organs contain irritants because of this digestive nature, and so any rupture there could spill some of their contents into otherwise sterile abdominal or pelvic cavities. Now we want to contrast that with solid organs such as the liver or the spleen or the ovaries, and these are highly vascular, and damage to them could result in some internal bleeding and possibly hemorrhagic shock. If you consider blunt trauma, a useful image might be this. Imagine trying to strike a water balloon with a baseball bat. That would represent a solid organ. Contrast that with striking a regular air-filled balloon with a baseball bat, and then the difference that we would see there. That solid organ is much more susceptible to the trauma and can result in internal bleeding. So we also have organs in the retro, meaning behind, peritoneal space. The peritoneum is that sort of lining of the abdominal cavity containing most of the GI and GU organs, but behind that space we do have the kidneys and the ureters. And their job is to transport liquid waste that have been filtered from the blood in the kidneys to the bladder, which is lower in the pelvis. Keep in mind also in that space we can have some of the larger blood vessels as well. In the abdominal cavity we have the abdominal aorta and the inferior vena cava. Both of these are in that retroperitoneal position. They're located closer to the spine. And of course, any injury to those blood vessels could lead to life-threatening blood loss through hypovolemic shock. Now, abdominal pain may be felt in a specific organ, and so we can describe that as parietal pain. It helps me to remember this, parietal meaning pinpoint. Why? Because there are sensory nerves in the skin and the peritoneum that will help us locate exactly where that particular pain is. Contrast that with visceral pain. Irritation of the visceral nerves is very generalized and diffuse, and it's difficult for a patient to locate the pain exactly. Now, along with this is we can get referred pain. If we have some sort of distension or contraction of the peritoneum, it's going to stimulate some stretch receptors that cause pain to be perceived at a distant location. One example is that spleen pain may be referred from the left upper quadrant actually to the left shoulder. That is referred pain. Now, specifically in terms of some anatomy pieces, just keep in mind the female reproductive organs are located in both abdominal and pelvic cavities. The very superior part of this system, we have the ovaries and the fallopian tubes connected to the uterus, and lower down in the pelvic cavity, the cervix and the vagina. Male reproductive organs are principally outside the pelvic cavity. The testes hang below that pelvic area within the scrotum. In summary, just a review of these systems, and in particular, the GI and GU systems and their location in the abdomen, so that when you complete a secondary assessment by palpating quadrants, it's going to just help you identify some of these common disorders as best you can. Remember, symptoms can be vague or misleading, and so this is going to be a challenge for you in your assessment.